most people, I know even mine are not super muscular, and you can see it. It's the muscle that kind of, if you look at your thigh on the outside, it kind of indents right here. That is the vastus lateralis. And it extends kind of from here all the way over to here. Okay. And then how you look at it when you're giving injections is if you were to take the whole thing and divide it into thirds, you're going to use the middle third. Okay. So, and then you'll alternate. Okay. Which they probably had already told you. Yeah. So the first thing...
Put your pants down.
You want to draw it up, and I don't know if they explained that you'll end up getting 2 different needle sizes.
Yes.
And the reasoning is this is a very, very thick serum. So it's just a lot easier. It's usually prescribed with an 18 gauge needle.
Okay. Clean the top off?
Yep, clean the top off with the alcohol dry. And then these are always sterile, so you want to avoid touching it when you put the 18 gauge on. I don't know what size. These might actually already come with the 18 gauge. I don't know what they are going to be prescribing you. Okay. But you'll start out with, you can draw back air and inject it into it. With testosterone, it doesn't make too much of a difference. It's too, some things that come in a vial, if you inject air before, it will just push it back into the syringe, but it doesn't make a big difference with, so that's up to you. You can test it out, but you're 100 cc's per week, and since this is 200 milligrams, or 100 milligrams per week, it's a 200 milligram serum, so you're gonna do a half of a milliliter or a cc, whichever you like to call it.
Explain that again. How to know how much to put in the syringe?
Well, it'll have the prescription will come.
Okay. Okay, cool.
It'll be printed on the outside. So most of the time it's prescribed at a 200 milligram strength, which for some people they do it every other week, and so they end up giving a full milliliter. These are milliliters or cc's, depending on what you want to call them. They're exactly the same thing. So it's a 3 ml syringe, and since you're doing 100 milligrams weekly, so 200 milligrams for this 200 milligrams per ml would be to the 1 milliliter mark. You're at 100 milligrams, so you'll be at a half of a milliliter.
Okay. Thank you.
Yeah, no problem. And then we will change to the, because this needle is really large, definitely don't want to inject yourself with that. Okay, and now we are ready.
What number did you change to?
23.
23, so 18 to 23?
Mm-hmm.
Thank you.
Sometimes people will get it prescribed with a 22. It's not too much of a difference. I like to give it with as small of a needle as possible.
Okay.
But you have to be a little more forceful with the 23 because it is really, really a thick serum. Alright, so we're going to be on the right side. Are you going to be standing or sitting when you're doing these?
Sitting.
Okay, so you can go ahead and sit down. However you're going to normally be doing them. So you bring the right side. I'll give you the... Is that from...
No, that's from my dog. That was the bruise from last time.
Oh, so if you flex your muscle, you see how it kind of changes. It's the one that changes right here. You can kind of visibly see it. It's basically this side of your leg, and I have some good printouts that I used to print out that I can give you. Okay. And if you were looking at it, the whole muscle from here to here, and you're dividing it into thirds, it'd be about this mid-third area. Okay. So you're going to want to clean the area. Clean it.
Now you can see it better. That muscle.
And then I like to, because once you clean it and you've identified where you're going to go, I mean, a good mark for you is you have a little bit of redness, and right at the end of the redness, that's where you want to inject.
Okay.
And then if you dry it off, if you don't dry off the alcohol, you'll find it really stings. Okay. But you want to be as sterile and as clean as possible to avoid infection. loosen the cap for you. You wanted to inject this time, right?
Yep.
Okay. So you take the cap off, and then you go in at a 90-degree angle, straight directly in, and you're aiming for, but you're not, it's not darts, so you want to kind of anchor your hand, or when you're right-handed, that's perfect.
So just go in?
Yep.
How deep?
You'll go in with that entire needle, because it's
Okay.
only a 1-inch needle.
And then just
Yep.
push this in?
And then pull it back out.
Hey, I didn't bleed this time. Yeah, alright.
Put that in the sharps for you. And you can get a sharps container from any pharmacy,
Okay.
usually. I know Fred Meyer's does exchanges of them. And then I always put a little bandage. It'll bleed a little bit, typically with anything going into the muscle. But you did great. How do you feel?
Good.
You did awesome.
Thanks. I'm excited I did it myself.
Yay. That is awesome.
When do you have questions about the like now what? Yes. So since I did do it myself this time, is it possible to have it called in so that I can pick up the stuff, or do I have to?
He
come
wanted
in
you to
one more
come
time?
in for a month, so I think that would only be one more.
One more, yeah.
And so next week, when we come in, we'll have you draw it up and go through the whole process yourself,
Okay.
identify it yourself. There's also, and if you are injecting, there's other muscle that you can use, the ventral gluteal, which is really easy to identify. So if one day you feel like, I don't really want to inject it today, the ventral gluteal